anesthesia job is ultra competitive. I think I can put it as ultra pro max competitive. Heard like for one job they like get like almost 400 to 500 applications.
Oh,
So
that
yeah,
is.
Hitler and labor market testing. So each job is first given to local applicant only. They will prefer local applicants because there they have done their edic and still they are in like they are not still not got their general registration because general registration progresses through paths. Either you much higher remuneration, maybe
Hmm.
500,000. That's what my
500,000.
approximate guess was would be. Yeah, until you hit the consultant.
Hello, all. This is Dr. Dheeraj Masapu, and this video we're going to discuss the problems associated in the pathway to Australia. And we have Dr. Vigneshwar with us, who is done his MD anesthesia training in India. After that, after certain years of experience, he'll tell his story better. So, after certain years of experience, he moved to Australia, and he's at present working as a registrar in Wollongong Hospital, which is located. It's an hour drive from Sydney. And welcome to the channel, Dr. Vigneshwar.
Hello, sir. How are you
I'm fine, I'm
doing?
fine.
Yeah.
So we
So
want to hear your story from beginning in a brief and concise manner, and we
yeah,
want
like
the reality and open heart
yeah,
discussion.
sure, sure. So a long story short, like I did my DNB anesthesia in Bangalore, and followed by that, I get like 3 years of experience. I was working in private setup, and fortunately, I met Dr. Dheeraj sir in one of the fellowships, like observerships, sorry, for like 2 week observership, which was very fruitful for me. And during that time, I used to tell like I was getting interviews from New South Wales Health, where I'm right now. I'm grateful to be first thing. I should be grateful for getting a job offer in Australia because it's not that easy to get a job offer. Because I there are different pathways to come to Australia, as you might be knowing. There are standard pathway, competent pathway, and a specialist pathway. I didn't come in through any of this pathway. I came in through another pathway, which is called short-term training pathway. So basically, what they look in this pathway is like they see your experience, like how many years from graduation. Here, the post-graduation actually means like how many years after your MBBS. That is actually counted as number of years from graduation, and what kind of specialist experience you have, and like what is your skill set you have. That is the main thing they concentrate here. And the jobs market is not that easy here because many people who are inside the system inside I'm working in New South Wales Health. There are like different health systems all over the country. Like there is Western Australia, there is Northern Territory, there is South Australia and Victoria. But I work in New South Wales Health. That like it's the Eastern Australia where I'm working. It's like 1 hour from Sydney. I'm working one of the hospitals as ICU registrar. What I wanted to say is like um, you need to have experience at least a solid 3 to 5 minimum of 2 years, at least like 5 years I would say. But those who are graduated from anesthesia, like background in anesthesia, getting an anesthesia job is ultra competitive. I think I can put it as ultra pro max competitive.
Like a new iPhone model 17.
Yeah, ultra pro max competitive. Anesthesia is job. Maybe Dheeraj sir like would be ideal candidate because he will be like coming under SIMG. Like he will have substantially comparable because he has huge amount of experience, lot of research experience. He will be fitting in the category, but it differs from candidate to candidate. But straight after you finish anesthesia, getting anesthesia job here, I would say it's like one in a million
Difficult.
chance. Like
Oh
very
man,
difficult,
then it is very tough actually.
very tough. Yeah,
So
uh,
in my previous videos, I was like very much encouraging people to go to Australia.
yeah,
Uh, so that is why we are doing this video, me and Vigneshwar. So the reason behind doing this video is to tell ground reality.
Yeah, yeah.
about what exactly is that. So that is what you're telling. So ultra competitive means what exactly? If they don't get a job or then
It's not like because I've been in with a lot of consultations with a lot of my consultants here, and like the registrars who I work with, the junior doctors who I work with, along those who come for rotations in the ICU. What they say is like the number of training positions is less, and the number of applicants who apply for the position is very high, because I heard like for one job they like get like almost 400 to 500 applications.
oh,
So
that
yeah.
is
Yeah. So, but in fact, the trend is changing, and now even the emergency jobs, the emergency department and ICU is also becoming very competitive, because they have to find a way to get into training, right? Because uh, they have to have some career progression end of the day.
we'll clarify a little here for people.
Yeah.
So getting a job is the important step in
Yep.
entering Australia, correct? No? So then, like ICU will have better chances than anesthesia, is what
Yes.
you told.
Post anesthesia. Post
So one,
anesthesia.
these jobs are for a year or 2 year. What exactly is the job basically?
So basically, in Australia, the ICU jobs usually work as like a 1 year contract. Some
Okay.
ED emergency jobs give them even 3 year contract. It totally depends upon the hospital and their need. But usually, my contract is like 1 year, and it's like you have to give an interview for the same hospital where you work, and you still need to give the interview, and like still need to apply for the job. And if you offer a job, you continue in the same hospital.
Okay.
Yeah, so that's how it works. The system
So
works generally.
okay. Then coming to the visa. So you got a
Yeah,
job. So this
yeah.
visa also gets renewed every year, or what is the exact thing about the visa?
So there is a tricky thing about this visa is like, first when I got a job, they give you the employment offer. So they the current district where I'm working in, the health district sponsors you the visa. Like there is a visa called 482. So that is the visa. Now it's now changed as skill and demand visa. So that 482 visa is sponsored by the health district where you
It's
are
like
going to work.
H1B of USA, I think.
Yeah, exactly. So they sponsor a visa, and but we need to file the application by our own, which costs like $4,000 per applicant. And usually the company the company will support your family, like your close family, like your wife and your maybe your kids. But you can't try to bring your father and mother, like
Hmm.
it's too much for the it's too
Yeah,
much
yeah.
on you, because
Obviously,
yeah.
it's not possible like that.
Yeah.
Yeah.
So maybe you can bring them on a visitor's visa, but this
Hmm.
is one thing. But there is a catch in it. It depends upon the employer will want you to like keep you for 3 years. They will the maximum duration of the visa is like for 4 years. Usually the Hong Kong visa passport holders get 4 years, but it totally boils down to the immigration officer. He decides how many years of visa he's going to give you, because
Hmm.
few of my colleagues like get I've got only 1 year of this 482 visa. So every year you need to renew. So every year you're going to spend close to $10,000 for your
Oh,
family. Yeah.
$10,000 is a big amount actually.
$10,000, like 4,000, like 4,000, 4,000, 8,000, and yet for kid would be like half the price. So it's
Okay,
going to
got
be
it.
like close to
So
ten thousand
basically,
dollars
even you get a job, so job should get renewed for a year, and your visa also
Yep.
should be renewed for a year.
Yeah.
So it is like
It
both
is.
the areas
Yeah.
you have to keep checking
Only if
basically.
the employer is willing to extend your contract, then they're
Hmm.
gonna even sponsor you.
Okay, got
So
it. So it is not that easy. So that is the intention of this video also. We'll talk about all the difficulties and ground
yeah,
realities basically. Okay, then there are so many viewers in my channel who are like in all specialties, not anesthesia, who want to
yeah,
get into Australia.
yeah,
Okay, so then so everyone will go through this kind of problems
yeah,
only.
yeah.
So got it. So what do you recommend then? What is the best way to come?
I would because I've been getting a lot of requests from my friends and like how to approach this pathway and like stuff. I would tell them is like clear the AMC exam, I would say, and try to apply widely. And like because there are the just Eastern Australia, which is there, but there is also Western Australia where there is a lot of positions available. But the thing is, it boils down. There is a thing called Australian labor market testing. So each job is first given to local applicant only. They will prefer local applicants because
Oh,
end of the day they
okay.
have to create job for the people of Australia. So that is one thing. And the second thing is who are permanent residents or who are already citizens, they will be given a second priority. And when the job is not filled by the local applicants, then it goes to like there's a thing called like minimum 30 days of posting it on a health website, and they will make it more public. And then because every job application will have a line at the end of the job description, like when there is no one from the same country, like if they are not filled up the position, then they will be able to offer to who is on a temporary work visa or like a permanent resident of Australia. So
Got it.
it's
I understand. But obviously, they have to give priority to their own
yeah,
local
they
people.
have
No?
to because they are
That
paying
makes
taxes and stuff like.
no, that makes
So
sense actually.
end of the line, like it all happens down to like when they're not able to fill up the position, then they're gonna look for international IMGs. That's where the IMGs come in. Yeah,
So now you're
for
recommending
specialists, this is
AMC.
the
That
way.
is standard
Yeah,
pathway then.
yeah, because I heard like even for getting into anesthesia positions and like other positions getting a surgical position, they say getting a general registration is much better because if you have general registration, you will still be able to get jobs, two locum jobs anywhere once you get a job. But if you are going through a specialist pathway, once you have completed only the final fellowship exam, you will be given the specialist registration, but you will be still on a like kind of a transitional registration. So that is the difference between the standard pathway and the specialist pathway, because there are candidates here who are like my colleagues. They have done their MD anesthesia and they have done their DM critical care, they have done their EDIC, and still they are in like they are not still not got their general registration, because general registration progresses through paths. Either you clear AMC 1 and AMC 2, then you get the general registration, or else you clear the AMC 1 and there are some WBA accredited hospitals. The hospital where I work is a WBA accredited hospital. So through this path they can get the general registration. So general registration is like how we get a Karnataka Medical Council. Once we finish
Mm.
MBBS, we get the medical council registration. Same way, the Australian candidates who have done their MBBS medical school training, they get the general registration directly. They don't need to write the AMC, all these exams. It's for the IMGs who come through this pathway need to get the general registration. So either through clinical exam or through the WBA, and there is a lot of competition for WBA as well, because you can't give WBA to everyone.
Mm.
So there is a separate interview. There is a separate because in order to be entering to WBA, you should have at least 6 months of ED training, and the other 6 months should be rotated in emergency medicine. Sorry, in general medicine, psychiatry, and general medicine.
Oh,
So
any like even if you're anesthesiologist, you have to go through all these things.
yeah, if you want to get the generalization, because you're not gonna get a straight up anesthesia position anywhere. And like I have mailed a few consultants and like I spoke to a few consultants. They say like if you get a general registration, that means you are even eligible for PR. You can apply PR on your own, or even the employer can sponsor your PR.
Understand?
So yeah, so it makes, because it what I want to emphasize is like If you are limit, I'm on a limited registration currently. If you are a general registration, you don't need any more supervision. Like you can practice, you can still, you don't need, there are different levels of supervision. And if you are on a general registration, that means like you have crossed all the levels of supervision and you can practice on your own. And less paperwork on you. The less paperwork, the less easy to handle you and stuff, because I'm on limited registration. I have the employer has to sponsor the visa, a lot of things. So
Got it. I understand. So it will be easy for hospital to get you something, correct? No?
yes,
You're in general
exactly.
registration. So guys, then better to do AMC 1 and 2. That is more better
AMC
than
one and
specialist
two,
path.
that at least safeguards your career here in Australia, because I met few people who are coming for finish their
Specialist.
OBC, PG, and like trying to get it. They will start as a registrar, and they will need to apply for the specialist college for their comparability assessment. They might not get, because India is considered as a non-comparable health system as per all the specialist colleges criteria.
Hmm.
Only the recognized countries are New Zealand, Ireland, UK, and Canada.
Hmm.
Even for
Uh,
US, I don't think it comes under the. Even if you come from US, I think you have to have at least 1 year of experience here.
experience.
Like, yeah,
So even American board is not like completely comparable.
completely comparable. So
So got
India
it.
is completely non-comparable, and as per ANSGA's requirement is you need to have 48 months of specialist training. That's what clearly it says. And unfortunately, Indian specialist training is 36 months.
3 years basically.
Yeah, so by default, our training system
Hmm.
is
It's
just
not
36
comparable.
months. The first line
Pakistan is 4 years.
comparability. But there is a subclause in one of the comparability assessment where ANSGA clearly says that, like, if you have specialist training, like specialty training, like maybe cardiac or neuroanesthesia, or like maybe pain, that will be considered, and maybe some years of fellowship in other specialties, subspecialties of anesthesia will also be considered. But it depends. And it also clearly says that extra years of training should not be like a national standard. Like it's not should be a part of the curriculum. Like if DNB says like you have to do 1 more year of neuroanesthesia, it doesn't matter. It should be a separate training apart from the DNB or MD what we do.
So
So they
basically,
will take
MD with IDCCM. For example, I'm
MD with
saying.
IDCCM. IDCCM is not considered as a, it's not
Uh,
NMC recognized degree.
so MD DM.
So
If somebody is there.
yeah, MD,
MD.
DM, yeah, and fellowships will be
Hmm.
considered. But yeah,
Got it.
so
So basically, our PG, I think, should be made 4 years. Then it will be very easy.
that's what many people, even there are a lot of specialist colleges, because I know the situation with the other colleges, because there is a candidate who got his substantial comparability from India in the Australian College of Emergency Medicine, because he had extensive experience post like almost 6 years, 6 to 8 years.
Hmm.
He got substantially comparable. But some colleges, they have the quality standards. It needs to be stringent, because they need to have a standard. If they don't have a standard, then risk of patient safety is breached, and like a lot of things can, because we all come from a different health system, and like adopting the new protocols takes time. So it definitely
Uh,
needs a standard.
we'll come to this guy who did emergency medicine, for example, and
Yeah.
6 to 8 years experience is there.
Yeah.
So, do they see publications and all that, or 6 to 8 years experience is fine?
I have not gone in deep to ask about his research experience,
Because
about
substantial
what he
comparability
done.
or partial comparability, what did they give? Like substantial.
Because what I can see on the website, overall with all specialist colleges, they are not considered. They are not considering the research, maybe they should consider, because because when you submit the CV, there's a CV which you submit to the specialist college. Maybe you can add on all those things, but they're only concentrating on the months of training.
Months of
But
training.
there's separate uh, page for like how many publications you have done, like how many audits you have done. But
Mm.
there is a separate section for CPD activity,
Mm.
but maybe that comes under the CV part of the statement, where you have to submit your CPD activity proof as well.
Then better to wait for 6, 7 years, and then after
Yeah,
that.
I would say a solid 6 to 7 years experience. Go for away from India, go to
Mm.
UK, or like go to Singapore, get
Mm.
some good experience there. Then coming to Australia would be because I have seen a lot of specialists been given a position here just because they
Mm.
had because I heard like one of the consultant who worked with Devi Shetty way before NH was started, and he is one of our anesthetic consultants. And like there are ICU consultants who have had extensive experience way back in Middle East, elsewhere, and they have cleared the final fellowship exam. Now they are consultants here. Yeah.
So to become a consultant there, that particular person should either come through AMC route or specialist route. If
Yep.
they have 6 to 8 years experience with some kind of fellowships in Singapore and all, they can apply in a specialist way.
Specialist way. They will definitely get some amount of partial comparability or substantially comparability based on their experience and stuff, I think.
Got it, got
So
it. So
standard pathway
immediately,
is definitely going to take some time. It will take some
okay,
time
fine.
because you have
I
to
am MD
progress.
pass out. Directly, I want to get into this one. Then AMC, I'll write and I'll apply.
AMC would be the better choice if
Mm.
someone who's like had extensive experience,
Mm.
10 years post MD anesthesia,
Mm.
DM critical care,
Mm.
they will have a higher chances of getting a partial comparability, definitely.
Then even then it's a partial comparability. Okay,
Yeah.
so direct people will go through MC, and so what I understood with your experience is that it is ultra competitive to enter anesthesia, so better to try in emergency and critical care paths.
Emergency and ICU. Yeah. ICU
Why?
jobs. Yeah. But ICU is very good because you get like to work 1 week and the next 1 week is completely off.
Hmm,
So you work like 1 week on and 1 week off.
got
So
it.
that's a different way. And emergency roster works like you work for 4 days, you break for 3 days, and work for next. So look, maximum you work like 40 hours a week. So since
Hmm.
I work 80 hours a week, but the next almost 1 week I'm completely off.
You can go for a vacation and come.
Yeah, I can go
You
for
can go to India
vacation.
and come back, huh?
Yes,
This
we
is
can. So the only thing we have to travel and time zone variation would be there. You will
yeah.
feel a little bit jet lagged, but it's a good way of balancing our life. Yeah.
Got it, got it. You can do some other hustles, or the
Yeah,
side hustles you can start.
you can work on your research project. You can work on your hobbies,
Yeah,
and as you're holding a YouTube channel,
these
those
kind
who
of
are
things we can
wanting
do.
to do content creation can work on their content creation, all those
Hmm.
stuff. Yeah.
Then it's a good thing only if you put effort, and so then anybody can try, but a lot
Yep.
of effort is there, little bit of risk is there. If somebody is
Yep.
ready to take, they should try, I think so.
Yeah.
So salaries
Because
we'll
end of the
discuss
day,
little after this.
yeah, I would say like there are a lot of opportunities here
Hmm.
because I thought like in India, if you do emergency medicine, you can only get into emergency medicine. That's it.
Hmm.
And I spoke to a lot of few registrars and consultants here. Like there is medicine. There's another specialty called retrieval medicine. Here, retrieval medicine is really good because the system is so well organized. Because after your emergency training, there's a subspecialty in emergency training. What I heard of, but I'm not very sure. You can go into toxicology. You can go into retrieval. There, where you fly in choppers, you go into fixed wing
Oh,
aircrafts, ambos, and you go fly into remote parts of Australia and like pick in the patient and like get back.
action.
And That's actually retrieval jobs are actually very competitive as well. I heard
Great.
retrieval jobs because you those who are having interest in aviation who wants to blend aviation with medicine.
Yeah,
Most
it'll
of the
be
people,
good.
there is another thing called Royal Flying Doctor Service as well.
Got it.
So a lot of opportunities because I have seen an anesthetic consultant from UK. He was an retrieval consultant in RFDS,
Got it.
Royal
Super.
Flying Doctor Service. Yeah,
So then, if I have to talk about salaries, basically,
yeah,
like, see, in
yeah,
the beginning, I wouldn't ask about the salary because beginning it will be more of survival. Once you
yeah.
become a consultant or some at least that level, what would be the salaries actually there?
I would say consultants earn because as you can see the if anyone has doubt, like you can they can go refer the Australian ATO website, which
Hmm.
actually lists out which are the professions are being highest paid professions. The first one comes surgeons, anesthesiologists. Third one comes as doctors, like
Hmm.
because surgeons and anesthesiologists both are doctors end of the day,
Hmm.
and almost the top 10 are occupied by medical fraternity.
Oh,
So
among all the professions in Australia,
among all the professions, it's the highest paid:
like it will
surgeons,
be, uh,
specialists, and yeah,
it will.
ICU consultants. Yeah,
So if
those
you have to
two.
tell the number like 300, 250 to 300.
Because you once you're a consultant, you can even work in private as well as public hospitals.
Hmm.
So a combination because private hospitals pay you much higher remuneration, maybe
Hmm.
half a million. That's
Half a
what my
million.
approximate guess was would be. Yeah, until you hit the consultant level, it's going to be a hard climb, but it's worth. Yeah,
It is worth after that. So
yeah,
that's it. See, guys, if it is, but any profession you take, even in India, there is some
yeah.
element competition is there. Recently, I
Yeah.
read video on anesthesia and the kind of competition. In tier two, tier three, also there is competition. So
Competition,
competition
yes.
is there
Yeah.
like everywhere. So
Yes.
better to put efforts in area where the end result would be like this. Is what I feel. I
Yes.
personally feel it is
Yeah,
worth the
that's
effort.
what I would say is that like any opportunity in Australia you get, it's a
Hmm.
it's a golden ticket. You make sure we capitalize on it,
Hmm.
work our way into the system, and like get all the experience. Work
Yeah.
hard, like show your skills, show your confident. That's what end of the day, my consultants, all the everyone gives you proper feedback when end of the week you ask your consultant like how you
Hmm.
did your with them, and like they uh, they speak to you open heartedly, and there is no hidden remarks about you. If they don't like it, just they just say it right to you. Like it's a good way to grow as a
Yeah.
and there is no
Proactive.
like sir, all these things doesn't happen here, and just a formal way of communication. You can address
Hmm.
them with their first names. If you are very hesitant, you can use a doctor in front of them, they don't mind.
Hmm.
But still it's a different health system overall, and like yeah,
So
it's good to have a good
basically,
experience.
we have to be proactive and then add value to the system where you're working. Then everyone will like you.
Yes, yeah,
If you're
that's what they
dull,
expect. Like be communicative
hmm,
because as we come from generally as we come from India, we are more humble, and like we try to be
yeah,
more very what to say, like yeah. So
I
we have to be
understand.
very sound, and because we have got all the skills and knowledge, we just need to be very confident in how we
Hmm,
present ourselves. That's it.
true. Got it. Superb. So we got a lot of information about the ground reality of saturation, which there is no way to get this information basically. We
Yeah.
can get the other information of salaries and all that from the websites, but what exactly is happening in the ground, there is no way we can get. Thank you for this particular information.
Yeah.
And you should come once in 6 months to update. your life story
Yeah.
also in the channel so that people can track all your
Yeah.
videos. I'll make a separate
Yeah.
playlist for you so that somebody
Yeah.
wants to come, they will follow you for some years.
Yeah.
So your
Like
next
no
plan
one
would
should
be.
be discouraged to apply, sir. Generally, I would say no one should be discouraged. Like
Mm,
because when I started applying, I like applied for like close to maybe 200 jobs.
mm,
I'm grateful that I got a job here in Sydney, near Sydney, close to Sydney. So it's always like the right time and the right moment. Someone will have something open up for them with the amount of
correct.
experience they have. Yeah, just need to capitalize on it, I would say. Yeah,
Okay.
yeah.
So thank you, Vignesh. Then
Thank you. Thank you.
we'll have a follow-up meeting, and thank you very much for coming